I was not very happy with the result. Either the patient and the surgeon as well were skeptical about doing a deep plane facelift because of the risk of the nerve injuries and stuff like this. But when I tried it for my patients, I saw the changes of the result much way better, very natural and long lasting as well.
I saw that you do so many cases, and not many surgeons in the whole world do as many cases of you. The number of cases plays a big role in the way to be able to judge the surgery.
The beauty of a deep plane facelift, it treats the fundamental roots of aged faces. It tries to reverse the problems that happen with aging. There is nothing like this. And the result will not stand for a long period of time. If you destroy your fat, you're going to be look more aged with time.
So we can say facelift, deep plane facelift is really nice, and it gives natural, long-lasting results. Hi everyone, we're here at the Swiss-German Deep Plane Facelift Congress. With me is Samir Ghoraba.
Yeah,
thank you so much for being here.
Thank you. Thank you for having me.
Wonderful having you here. We had such a great time doing facelift together.
Yeah.
We're here in the Dorow Clinic, and we have this collaboration with ChiroFace, with Leeds Private Hospital, and we did the first Swiss-German Deep Plane Facelift Congress, and it is great to have you here as one of the leading deep plane specialists of the world.
Thank you so much for inviting me to this unique congress. I enjoyed a lot changing experience with your surgeon. They are at high level of experience. The questions and discussions, I learned a lot from them. Thank you for having me here. Yeah.
Thank you. And we want to give our knowledge a little bit to our audience and speak about your journey of your way doing the deep plane facelift and educate people about this special and this wonderful technique of facelifting.
Yeah, actually, in the beginning, I started my career as a microsurgeon. So I had my initial training in Changgang Memorial Hospital in Taiwan for 1 year with Fu Chenwei, the famous surgeon for microsurgery. And I was a dedicated head and neck reconstructive surgeon. Then I came to a moment that I want to make more changes to people's life. That's why I love the facelifts. Then I started in the beginning the normal facelift, like superficial technique, which address the skin only, just tighten the skin, little sutures, and the smash or superficial muscles. And I was not very happy with the results, to be honest. Then I shifted my practice. This was like 7 years ago. I started to try the deep plane facelift techniques, which was still emerging. But all the surgeon was, even the patient and the surgeon as well, were skeptical about doing a deep plane facelift because of the risk of the nerve injuries and stuff like this. But when I tried it for my patients, in my experience, I saw the changes of the results. How is the result are getting much way better, very natural and long lasting as well. That's why I started to do like a deep plane facelift on my patients. All of them in the beginning were very happy with the results. That's why I shifted my whole practice and my whole techniques into just a deep plane facelift to address the aged faces. And now I'm getting a natural and consistent result for all my patients.
That is so wonderful. And I met you in Islamabad at the Pakistan meeting for plastic and aesthetic surgery. And I saw your presentation, and I saw that you do so many cases, and not many surgeons in the whole world do as many cases of you. And as we all know, in plastic surgery, aesthetic surgery, the number of cases plays a big role.
Definitely.
In the way to be able to judge the surgery. And so we can really trust your opinion.
Thank you for that. Actually, I think plastic surgery, especially aesthetics, is kind of a learning curve. So the more you do with the patients, the more experience you get, the more skills you get honed, and then the more natural and consistent result you can achieve. The idea is to come to a certain level to get a consistent result with all your patients. This needs a learning curve and experience. So in my practice, I do now like 300 to 400 cases a year, which is a quite big number of cases. And again, the teaching is a different story, because teaching for me, in addition to that, I love to teach, but I learn a lot through teaching. So there are two levels of surgeon. I think that if you do a surgery very well, there's a level, and there is another level when you teach your fellow surgeon. You learn from them. You pay attention to more details, especially when doing live surgeries in front of established surgeons. Yeah.
Yes, we felt that, and it was such a pleasure discussing all the little details of deep plane facelifting with you while doing the surgery, before doing the surgery, after the surgery, the markings, and even if it is all deep plane facelifting and it's very similar, there are still huge differences.
Yeah.
So there's differences between other facelifting techniques like mini facelifting and like skin only or max lifting, and then within the deep plane facelifting there are so many differences.
Definitely.
Maybe let's speak about why deep plane facelifting is so special, and why it is deep but it's not dangerous, or it's not more dangerous, or it's not longer surgeries than other techniques.
Yeah, because the patient, they hear the word deep, they gonna freaked out, because very deep is gonna be very painful recovery and a very aggressive surgery. It's not. Actually, the beauty of a deep plane facelift, it treats the fundamental roots of aged faces. It tries to reverse the problems that happen with aging. So the previous concept about aging, that the skin is getting more excess, more redundant. But now our current understanding of aged face, that the aging happens at the deeper tissues, deeper to the skin. It happens at the layers, deeper to the superficial muscle. We call it mass amplatysma. So to achieve a natural result, you have to treat the root cause. You have to treat the deeper tissue, not the skin. So for the deep plane facelift is more rational. And also, if you do it the right way with the right expertise, it's very safe. But of course, it needs a very good training, a learning curve. Then you can achieve a very safe and natural result. And if you do just a skin tightening, that's why, by the way, most of the patients were afraid of a facelift. If you remember, like 20 years back, facelift was not trending like today, because too many patients had like botched results. They had a plugged smile, a freaky facial movement, a crooked faces. All of these are related to the superficial technique, because actually they try to pull the skin. If actually you just pull the skin like this in front of the mirror, you will get an improvement in your face, of course. And the surgeon tried to do this just to take out some skin and they suture it back. The problem here is that you put too much stress on the skin, and you will get kind of a unnatural look of the face, and also you get a pulled ears, wide scars, and all of this we call it a butched facelift, or telltale signs of a facelift. But a deep plane facelift, you carry on the surgery at a deeper level, so you reposition the deeper structure. You can close the skin without any tension whatsoever, so you can have a natural result without any freak movement of any blocked smiles, and also the scars will heal very nicely without any telltale sign. So deep plane facelift bestows both beautiful and natural results. In addition to, of course, it's a long-lasting result. So that's why in my practice now, I never do what's called a mini facelift anymore, or a superficial facelift, or a smash application. Yeah.
Some patients or some people or some newspapers, they even argue and say, nowadays technology is so advanced, we don't need facelifting anymore, we don't need scars anymore, we don't need the scalpel, we can use radio frequency or laser or other kinds of tightening of the skin, or thread lifts. What do you think about that?
It's a very interesting question. Thank you for asking it. First of all, there is no scars with a good facelift. If you do a very good facelift, there is no visible scars. There's one thing. Second thing, the WHO just warned about, that released a warning about the radio frequency, especially the deep radio frequency, because all this stuff, or these devices that generates heat at the deeper level, it injures the deeper tissue. It leads to burns, real burns at the deeper level. It injures the fat, superficial fat, just under the skin, which is very precious. That's why the patient, the long term, they will have like unnatural faces with irregularities, with telangiectasias, and problem of skin change in the skin, and they will look actually more aged, not rejuvenated. And of course, if you just heat anything, it will lead to shrinkage. And this thing is just temporary. You can see that on social media, on Instagram, just the surgeons just showing you that just passing a probe or anything under the skin, and you can see the instant lifting. Oh, guys, you're kidding me? There's a water loss, not a collagen formation, because they try to sell the devices that it leads to an instant facelift. There's nothing like this. What happens actually is the tissues will lose the water, and then you will see an instant, very temporary shrinkage of the tissue, and the result will not stand for a long period of time, and you will see the look will be more aged, because if you look for the hands of old people, that you see the skin is wrinkled because of the fat loss. It happens the same with the face. If you destroy your fat, you're going to be look more aged with time.
So I think we can even be that radical as to say it is bogus. It really is bogus, and a lot of companies make a lot of money with those machines. And doctors think that it's the easy way, not having to learn a facelift. But those devices they are dangerous. They can destroy the subdermal fat, like you said, and make a distorted look, or they can increase the aging, can make people look older.
Exactly.
And it is not the solution.
I think the only indication for these devices, if the patient for 100% will never have a facelift in their lives. In a very rare occasions, like a severe uncontrolled medical conditions, a very old patient, a patient who had a previous facelift and they are not very keen to do like a surgery. It's a very limited indication for these devices. And I think we should be honest with the patient that on the long term, the result will not be very natural. And of course, it's going to be not long-lasting result as well.
I think it is the way is not to avoid the facelift, since clearly it is not possible to do that, not even with stem cells or anything else. We cannot avoid the facelift. So the solution is an undetectable facelift, like you said, and to have a safe facelift and a long-lasting result facelift. And this is what, since Sam Hamra started the Deep Plane technique 30 years ago, this is what has been that we have now. We have this tool in our hands, the Deep Plane Facelift, and it is exactly that.
I can't agree more with you. The Deep Plane Facelift, is irreplaceable. I think it is a gold standard now to treat aged faces. But the thing is, to my mind, the only limitation to the facelift is the tissue quality. That's a problem. We were just discussing this with the surgeons now.
Absolutely.
Because, doing a facelift, of course, is going to restore your face back, the position of your face, but it never restores the quality of the tissue. That's why we still have a rule for regenerative medicine. So I always tell my patient that we do now a combination between addressing your biology, improving your biology, in addition to doing the surgery. Because the surgery, we're going to do a mechanical thing for your face, so we can reposition your tissue back. We can augment some parts of your face. We can add some fat, even some implants in some cases, in doing genioplasty in other patients. But we cannot change the quality of the tissues. I mean, the skin quality itself, the quality of the muscles. It's I think it's going to be the future. If we find some trusted way to treat the quality of the tissues to get this improved, it's going to be like a breakthrough for the whole humanity, I think.
Absolutely. I think so too. But we have to be honest, until now, the breakthrough has not happened yet.
Yes. We're working on that.
We're working on that, exactly. We thought we were discussing, for example, nanofat, and even there is no stem cells. There's no real stem cells, and the stem cells that are available on the market in the whole world, they don't do what is promised with them.
The evidence, about this stuff is anecdotal. It's not very scientific now. We cannot say that it gives you a 100% result. I'm not very confident to tell my patient that doing one session of nanofat treatment will give you like this result. But in the surgery, you control the result somehow, more or less, right? But with this stuff, the body responses varies from patient to another. The techniques of doing it is variable. We didn't come to a certain regime to achieve a consistent result with these different modalities of treatment. That's why I think that it's still a growing field of research, not an application to the patients.
Definitely. I think that's it. And the application that we have now in our hands is the Deep Plane Facelift, and we know it's definitely superior to all other kinds of facelifts?
Yes, we see a good result, consistent result, and also we can predict the results. That's why it's a very scientific approach to the aged face.
And we know it's long lasting.
Yeah, definitely.
And so maybe let's address the worries that some people might have about deep plane facelifting. You know, how much does it cost? How long does it take? Is it dangerous? So maybe the first question is for who can get a facelifting, who should get a facelifting, from what age on? What are the signs that make people want to have a facelifting, or that when we would recommend a facelifting?
Yeah, very good question. From all the patients are asking about this. What's the appropriate age, the suitable age for a facelift? Actually, I don't believe that the age is a factor for a facelift. Nowadays, we see too many young, beautiful ladies with the saggy faces in their 20s, even or 30s, because we have now a trending, peptides and semaglutides and bariatric surgery. And too many patients will lose a lot of weight. A sudden weight loss will lead to like a saggy faces. So how we correct these faces? Only we can do a facelift, right? So the facelift, regardless of this age thing, we have kind of a solid indication for a facelift. The first one is a saggy neck. If you have a saggy neck, definitely you cannot correct this with any other things, just a facelift. The second indication is, we call it jowls or jowling. If you have an interrupted jawline here and start to lose a distinction between the lower face and the upper neck, this is the second most important indication. And lastly, the droopy cheeks. If you try to lose the volume here and get more volume down, that means that you have droopy cheek. And you can do, I always tell my patient, you can do a facelift simulation in front of the mirror. Just you stand in front of the mirror and try to emulate the facelifting effect. If you're happy with the result, you're a facelift patient. So it's more or less signs you can find in your face, then you're a facelift candidate. And the thing is, the earlier you do a facelift is the better. Because actually the younger the patient, the healing process is much easier for the patient. The recovery is very fast. The result is more beautiful because they don't have the very deep lines, significant changes in the skin as well. So the result will be more beautiful and long lasting as well.
So we could even, it sounds harsh, but encourage patients to have facelifts earlier.
Yeah, because again, beautiful results, no scars at all. It's very natural and long lasting. Why not?
Yeah, why not enjoy
with the current
more
techniques,
years?
with the current surgical techniques, we can achieve that.
So yeah, we know that an early facelift is good, and we know that we cannot replace the facelift by injecting hyaluronic acid. So even if the volume is missing here, if we augment it, there's still too much volume down there.
Come on, no gel can lift the face. In the surgery, we have to release the ligaments and deeper tissues to reposition the face, the tedious surgery. So it's not sensible to say that a very small amount of gel can lift up the face. Maybe expansion, maybe volume restoration. Yes, I agree on that. But for a lifting with a filler, no, definitely
Still,
no.
we have everyday patients, and I just need a little bit of hyaluronic acid to have this result. And this is so hard to tell them. But we have to be honest. We have to tell them, no way.
And if you treat your patient the wrong way, I mean, if you just listen to her and did fillers, they will not be happy.
Exactly.
They will not come to you again. Right?
Exactly.
So you reject this patient. In my practice, I don't do fillers for them. I do just fillers to restore volumes, do a little expansions, yes, but never for lifting.
Exactly. So this is the hard truth that we have to tell patients. But we can say that the deep plane facelifting in good hands, in experienced hands, is a procedure that is safe.
Yeah, definitely.
It is deeper, but it's the natural plane. It's the natural gliding plane of the face. And finally, surgeons go in that natural plane. And yes, it is close to the facial nerve fibers, but we can see the fibers and they're under direct vision, so we can protect them.
Like anything in the medicine, nothing is safe 100%. It needs training, needs good training. That's why some surgeons, are reluctant to do a deep plane facelift. But you're had a very good training. You have done tons of cases. Then you're a safe surgeon and achieve consistent and safe results. It's a very good surgery, again safe, but it's not easy. So you have to select your surgeon very well before going for such kind of surgeries.
So how about the healing time or the downtime? Many patients worry about that.
Yeah.
I think we both would say it's not as bad as people think it is. What do you think?
Definitely. The thing is, with doing a deep plane facelift at this deeper level, that most of the reaction from the body will happen at a deeper level. So it will never show on the skin. On the contrary, if you're doing a mini facelift or a superficial technique, the swelling and the bruises will show a lot because you're doing all your dissection and surgery just under the skin. Okay, that's the beauty of the deep plane facelift, by the way. So deep plane facelift, first of all, it's a pain-free procedure. I can reassure you with that. The patient in the first day gonna feel a little tightness in the neck, maybe discomfort, a little numbness here. The numbness is universal in all the patient, especially a couple of centimeters around the ears. It stays for a while, but no pain at all. A second thing that the patient should see after a deep plane facelift, minimal swelling, not a marked swelling. A minimal swelling which starts to increase in the first 2 to 3 days. With good icing and some treatments, it settles down. And 90% of the patient, like within 1 to 2 weeks. 90% of the patient in my hands, 2 weeks can go out to the usual activities and they're not sure that he had a facelift or something. But this should happen in all the patients. And for the bruises, it's not universal. Too many patients will never have bruises, but some patients are easily bruised. It depends on the body responses. And again, it takes 2 weeks. So we can say, generally speaking, the initial recovery after a deep plane facelift is 2 weeks in average. It's a pain-free procedure, but we have to follow certain instructions after the surgery to achieve the best possible results.
How long is the average duration of the facelift, and does it matter? Does it make a big difference? Is it so important for the patient how long it takes?
You mean during the surgery?
During the surgery.
It does not matter. Result is the most important thing.
Exactly.
Because there is no fixed time for a facelift, but basically for, the straightforward, the cases with the soft faces and just light necks, you can say that 3 to 4 hours. This is average. And some patient may take longer if they have a very heavy neck and needs like a deep tissue sculpture and a more advanced surgery. And other patients, we may combine the facelift. And most of the patients, actually, to be honest, they love to combine that with eye purification, blepharoplasty, brow lifting, and also a lip lift. So it takes more time. But the thing is, as you've mentioned now, the time of the surgery, the duration is not important at all. The most important thing is the results, to do the surgery very well in a precise way to achieve a safe and natural result.
I think a myth that we can maybe clear up is that the total anesthesia or the anesthesia in general is harmful to the brain, harmful to the body, and many people worry about that. But with the new methods, it is not. And I think that's the most important thing to tell people. Don't worry about the anesthesia. It is safe, and even if it takes 3-4 hours, it is 100% okay for the body, for the brain.
And I always tell my patient one thing, the most important thing during the surgery, is it risky or not? What are you doing in the surgery itself? For example, we're doing a deep plane facelift. We're managing the superficial tissues. We're not managing your body, actually. So we're treating your skin and the superficial muscle. For example, if some ladies go for normal labor or a cesarean section, it takes like 45 minutes or 1 hour. It's more serious, right? The risks are real. For a facelift, it's a lengthy procedure, but the risk is minimal.
Absolutely.
Right?
And the anesthesia just makes you sleep and relax while the surgeon is doing the procedure.
True.
Yeah, wonderful. So we spoke about the age, about the healing process. So how long is the downtime approximately of the facelift?
The initial downtime is 2 weeks, but for more or less near like a complete result, 90% of the result 6 months, and final result we always say 1 year at least. But and one thing I will tell you that's very interesting, in the first couple of years after a good deep plane facelift, the patient is getting better and better over time. So 2 years, the look is better than 1 year, and 3 years getting better. And I always tell my patient it's gonna be like aging backward, So,
and that is funny.
It's very interesting.
So true. Yes.
Yeah, it's very interesting.
Just downstairs after the surgery, Michael told us that he saw the wife of a surgeon he worked with, and he saw photos of her 30 years ago before the facelift. And he says she looks better now.
Yeah, definitely. Yeah. I can see this with my patient on a longer-term follow-up.
This is wonderful. This long-lasting result is there. There's no other technique or no other method that can not even closely get such beautiful long-lasting results.
Definitely, because the thing is, the facelift actually bestows it's a permanent result actually, because you just reposition the face, you cut out the skin, took out the glands, and do deep tissue sculpture, and took out the excess muscle as well. So it's a permanent change of the anatomy. But the thing is, our body is still aging. So I always tell my patients the result is permanent, but think of the surgery that I get you back in time. Like you're now in your 50s, but you look in 30s. So it's up to you. If you take care of yourself, got a good lifestyle, good skin care, and avoid any harmful exposure to the sun and other, smoking and stuff like this, you're gonna have like a very long-term results. So because so many patients will ask me for how many years it's gonna stay. Yeah, right.
I think I often explain it like this: is like you're set back about 20 years on your aging curve, and when you now say you're 50 and you're having a facelift, you look 30. And when you will be 70,
you're
you
gonna
will
be
look
always younger than your age group.
Exactly. Always 20 years younger than your aging group. And that is something really nice. And we've seen so many photos, like classmates together at a meeting, and the one lady who had a facelift, and she looks clearly so much younger, even 20 years after the facelift. So we can say facelift, deep plane facelift is really nice, and it gives natural, long-lasting results. And what would you advise people who think about having a facelift? How to start the process, and how to slowly, move towards the right surgeon, towards the right clinic, towards the right technique. How should they address this journey?
Yeah, it's a very important question, because we have too many surgeons now, and the pressure of the social media make it like very difficult to choose the right surgeon. I think the first thing, you have to find a board-certified surgeon. It's very important.
Yeah, absolutely.
Yeah. A second thing, you have to find a good and well-known place to do the surgery. It's very important as well. An equipped theater, an equipped clinic, a very well-known clinic with too many patients is a second important thing. And also to look into the results, which is make a huge difference. You have to see for the not just one or two or three cases. Doing one facelift does not mean I'm a facelift surgeon. You have to make sure that your surgeon at least I think 4 facelift a week to be a facelift surgeon at least.
Absolutely.
Okay. So the more you do, you cannot tell me that you're a facelift surgeon if you're doing 4 cases a month, or some surgeons do it a year. So you have to see a consistent result and natural. You have to look into the results. And when you look into the results, you have how to look into results is very important for facelift from a patient perspective. They have to compare before and after, because some patients will look for only the after. If they see like just a beautiful lady, they will like the results. You know what I mean? So, but they have to compare before and after. The thing you need to look at is the jaw lines, which is really important. The part under the eye is really important as well. The improvement in the perioral and around the mouth as well. These can tell you the difference between the surgeons. So, board certified surgeon, a well-equipped place, and the results. I think these are the most important thing the patient should look after.
Absolutely. I think take your time to find the right surgeon.
Yes.
And maybe have a second consultation.
Definitely.
Really think well about it. Take your time, and then go for it, because it's worth it.
And I always recommend to my patients, and even before they meet me for the consultation, they have to keep a sharp mind to ask the right question.
Absolutely.
The right question from a patient perspective are 2 things: the results, how it could be, and the recovery. Right? These are the 2 fundamentals for a successful consultation. Because, some patients, I'm now more concerned with the technique. They will come to you and, doctor, I will tell you an interesting story. Yes, you're going to do like a high smash Really, some patients ask me, doctor, can I do a high smash or extended Deep Plane Facelift, or what's your modification? It's a very technical thing. You know what I mean? And if I try to explain it to you, it's of no value. You have to understand the results and the recovery. And if you're happy with that, you go for the surgery.
Yeah, absolutely.
Yeah.
Absolutely. Yeah. So thank you so much for being with me.
I appreciate it. Thank you.
Wonderful discussion. And I think we gave a lot of information to our audience for their journey. And I think it is a completely new perspective of facelifting in general, because so many people have those 80s or 70s or 90s images in their head of celebrities looking stigmatized with botched facelift results, having pixie ears and having distorted faces or over-injected faces, and that is not the case with deep plane facelifting. It is wonderful, natural results, and this is why I think we're both sure that facelifting will be way more common in the future.
Yeah.
It will be the procedure, and we can see already the injections not aiming for over bloating the faces. And so I think this is a wonderful development in the world.
And actually the good injectors actually refer too many patients to me. And a good injector who respects his patients should tell the patient, you need an injection or a facelift. If he is good enough and he's confident enough, you know what I mean? Because if you treat your patient just for one time, you cannot retain your patient if you advise him with the wrong treatment. Right? So I think there is a rule for the fillers for certain indications. But facelift is a facelift. Once you get a saggy face, go for a facelift, please. Right?
Thank you. Thank you. I couldn't agree more. So thank you for listening, and have a wonderful time, and be beautiful, feel beautiful, and enjoy your life.
Your body, your face, your smile. Dorow Clinic.